Welcome. Many patients will take 2 to 3 weeks to adapt to CPAP. However, there will be a subset of patients who don't adapt to it early on or even a few weeks into it, and this will impact compliance. It's important to address the issues at hand. First thing is to address if the mask interface is a issue. Explore preference of the patients would be the first thing that you want to do, which is to address and see whether they prefer a full face mask or a nasal mask versus a nasal pillow. The next thing is to look at breathing style. Now, if a patient is a mouth breather, then the full face mask would be the best option. However, some patients are still placed on nasal mask and nasal pillows, and this will reduce the effectiveness of the CPAP. Hence, as the patient falls asleep and has an obstructive event, they feel like the mask is the cause of it. In actual fact, it's the obstructive sleep apnea which is causing them still restless sleep. The third thing, which actually should be explored even before CPAP started, is phobias. Some patients have pretty significant claustrophobia, and this needs to be addressed earlier on. Some patients just have phobias or reject the ideas of having anything on their face itself, and they have to be reassured that there are many different mask styles at hand, and this can be overcome. The next thing to look at is some patients will reject the idea of CPAP due to the suffocating nature of the positive airway pressure. Now, this is usually the case when they are in expiratory phase. Most of the time during inspiratory phase, the positive airway pressure helps with their breathing. However, during the expiratory phase, they find the positive or the constant positive airway pressure overwhelming and suffocating. What EPR, or expiratory pressure relief, does is reduce the pressure by anywhere between 1 to 3 centimeters of water during the expiratory phase. Hence, the patient does not feel like they're suffocating during the expiratory phase itself, and this helps many patients adapt. The next thing is to help them desensitize to the CPAP or CPAP mask is to actually put the mask on while they're watching TV. Sometimes while watching TV or even reading, they could have the mask on with the machine off. This adapts them to the idea of just having something, or normalizes the idea of having the machine or the mask on them. It's important as well to tell the patients to, when they do go to sleep at night, to use the same number of pillows or head of bed elevation as they did during the sleep study, which is what the pressure settings are based on. If that doesn't work, a mild hypnotic may work. It's important to note that the patient should not use heavy doses of hypnotics, which can worsen the sleep apnea and make their CPAP ineffective, or even a short-acting one which won't impair the morning sleepiness as well, or daytime sleepiness. A psychiatry referral may be an option in many patients as they struggle to adapt to the CPAP and still have phobias related to having anything on their face, and most psychiatrists will have to work with them through a phase of desensitization. If that doesn't work, then some of the other options to consider that are not CPAP related are mandibular advancement devices, which has to be fitted by a sleep certified dentist. There are hypoglossal nerve stimulators that are new in the market, depending on how severe the sleep apnea is and depending on obesity. Now, it wouldn't work as well in obese patients, but a hypoglossal nerve stimulator is a consideration. Lateral positional therapy is also an option in patients. Worst comes to worst, a bariatric referral or an ENT referral for patients who have the anatomy that will be amenable to treatment. Thank you.